It's changed our day-to-day lives, and there's one population that seems to be out of our view: the prison system. In American jails and prisons, more than 250,000 people have been infected with COVID-19. That's according to the New York Times. And nearly 1,500 inmates and correctional officers have died. Our Saskia Lindsay has been taking a look at Georgia prisons and their response to the pandemic. Saskia, you've spent 3 months looking into these allegations and speaking with inmates and their families.
Victoria, that's right. Family members of prisoners are looking for support while their loved ones are behind bars, and their fears have heightened since the start of this pandemic. Many of them turning to Facebook to share their concerns and their worries as this pandemic rages on, and tonight they're sharing their concerns. Terrified and helpless, that's what some inmates in Georgia prisons say they have felt since the COVID-19 pandemic hit.
Yes, he made a mistake, but he does not deserve to be treated this way. Nobody deserves to be treated this way.
These are harder, tougher guys, and they're scared. Something's wrong there.
Filthy conditions, severe staff shortages, no answers to desperate screams for help, left in a locked cell alone for days on end while fighting COVID-19. These are just a few of the accusations against the Georgia Department of Corrections.
An elderly gentleman, probably in his early 60s, got really bad sick, and he laid there for 2 or 3 days before the medical staff done anything for him.
The Georgia Department of Corrections website says that over 2,000 inmates have COVID-19, just over 2,000 have recovered, and 82 inmates have died. But one nurse who works inside Georgia prisons believes those numbers may be underreported.
There's been instances where there's been multiple cases not reported on the GDC website.
Scott Farr is a maintenance employee who works in several Georgia prisons, including Ware State Prison, that has been hit especially hard by the pandemic. He says the conditions he's seen in the prisons have always been bad, but since the pandemic, the conditions have become much, much worse.
They're not getting what they need. Us as a human race needs, a certain amount of nutrition, a certain amount of hygiene to be able to better our immune system and keep on living our lives. And if they're not getting that, they're not going to live their life.
Families of inmates are speaking out because they fear that their loved ones won't come home.
He feels like he's going to die if he doesn't get help in there. And I know this is too extreme, but I'm desperate to help my dad.
The nurse I spoke to remains anonymous out of fear of retaliation, but she says she has to speak out because she fears how grim the situation will get if nothing is done.
It's going to continue to spread, and more inmates are going to continue to get sick and die because nothing's being done, and that's not fair.
She says if inmates come down with severe enough COVID symptoms, they will be tested, and if they test positive, their situation can get even worse, being thrown in what's known as the hole for 14 days. She says the hole is where prisoners are normally sent for punishment. They are isolated in a cell by themselves and often don't have access to adequate food and water. There's no ventilation, no fan, and for somebody with COVID-19, this could be deadly.
Say if 4 days go by and no one goes by and checks to make sure they're okay, they could be declining and no one even know it. And then by the time someone realizes it, then it's too late.
Dr. Ann Spalding from Emory University works to help correctional facilities across the nation respond to the pandemic. And she says inmates should not be punished for being sick.
If someone is very, very ill, you don't just check them twice in one day and say that's all. What's very important is to check oxygenation levels, and people, as we know, can go downhill very quickly.
Dr. Spalding says some inmates are not even alerting staff when they're seriously ill out of fear of being put in the hole where they could be left for days on end without medical care.
At first he thought that he was starting to show symptoms of that, but he was afraid to speak out because he heard all of the horror stories of them putting the other inmates in the hole or in isolation and just leaving them there to die.
Being incarcerated is their punishment. Poor medical care is not punishment.
WGXA has made repeated attempts to seek comment from the Georgia Department of Corrections about the treatment of inmates during the pandemic, including specific questions about the allegations here. So far, we've had no responses to our requests. The GDC's website says extra soap and sanitation has been provided to inmates, along with masks and other measures to implement social distancing, but the nurse I spoke with says those policies are not being followed.
They put protocols in place to make it look like something's being done, but everybody knows it's just for show. It's just to show that they're doing something, but it's not enough.
Dozens of inmates have told me that they're in such close quarters that social distancing is impossible, and many inmates have written me letters saying they've been given no masks, no gloves, and no extra disinfecting is being done at these facilities.
Some inmates have reported being sick to guards and been told to go back into general population to, quote, sleep it off. Some of the letters we received from inmates say, "We are trapped in here in what for some of us has become a death box. We can't seek medical assistance whenever and how often we want. We are at their mercy as well as at the mercy of the virus." After the prison knew I was positive for the virus, they never quarantined the dorm I was in prior to being placed in medical isolation, nor did they screen, monitor, or test anyone in that dorm for the virus. It may seem like an impossible task to protect all inmates from COVID-19, especially when they're in such close quarters. That's why back in April, the Department of Justice awarded Georgia over $15 million in funding through the Coronavirus Emergency Supplemental Funding Program. These funds are specifically intended to be used to address the medical needs of Georgia inmates, provide facilities with protective and sanitation equipment, along with other ways of protecting staff and inmates from COVID-19, like testing. According to the Criminal Justice Coordinating Council, which manages these funds, Georgia has used zero of that funding. It has been sitting in a bank account for over 7 months. WGXA reached out to the council asking why the $15 million has not been used. And they say, quote, they are currently working with leaders in the state to determine the greatest use of these funds, end quote. WGXA also reached out to Governor Kemp's office, and their response was, the state has supplied significant testing resources, PPE, and infection control equipment to the Department of Corrections, and also worked with the DOC and the Department of Public Health to ensure facilities are aware of the best practices and guidance to limit the spread of COVID-19 and protect both inmates and staff.
I don't think that they care. They look at these people in there as numbers. They don't look at them as a human being. It's inhumane how they're being treated in there.
And testing, that's not something inmates say they're seeing much of.
You just say, I would like a test, they laugh at you. You're joking, right?
What's most important is to have a aggressive program of testing.
And without testing, some worry that only one thing is going to happen.
If it didn't spread like a wildfire, it would surprise me. But if it spreads like wildfire, it's going to be bad.
It was like they're warehousing us, we're money to them. And they just, basically, they really don't care if we live or die.
And the people in Georgia prisons have a message for state leaders.
Mr. Ward, the Commissioner of the Department of Corrections, as well as Governor Kemp, needs to be more mindful of, the situation in the Georgia prison system. You're packing all these inmates in these buildings. They're basically on top of each other, and we're in the middle of a pandemic, and you're not taking any type of precautions.
With a second wave of COVID-19 hitting this winter, some of the staff at prisons and the families of inmates are just praying that prisoners make it through the pandemic.
If the inmates make it through the pandemic and everything that's going on right now, I mean, they should get on their knees every night.
They're all someone's family, and they're all someone's dad or someone's brother, and they're doing their time, and that's their debt. They're paying their debt to society. They don't deserve to sit and die.
I worry about all my brothers and sisters behind the fence in the Georgia prison system, and something needs to be done about it.
Again, we have reached out to the Georgia Department of Corrections several times and have yet to hear back. You can follow this story on our website at WGXA.tv.